Natural ways to prevent bleeding gums and maintain oral health. Healthier smile. How to stop bleeding gums and transform your smile into a showstopper. If you're tired of hiding your smile due to bleeding gums, then this video is for you. We'll show you the best techniques to keep your gums healthy, recommend the top vitamins and supplements to take, and provide lifestyle tips that will give you a confident, healthy smile. So let's dive in and transform your gums and smile into something you'll want to show off to the world. Bleeding gums are one of the most common oral health problems, affecting millions of people worldwide. It's a condition where your gums start to bleed easily, especially when you brush or floss your teeth. While it's often a sign of gum disease, it can also occur due to other factors. The most common cause of bleeding gums is poor oral hygiene. When you don't brush or floss your teeth regularly, plaque and bacteria build up on your teeth and gums, leading to inflammation and weakened vessels. This early stage of gum disease is called gingivitis and is usually reversible with proper dental care. Other causes include hormonal changes, such as during pregnancy or menopause, vitamin deficiencies, especially vitamin C, certain medications such as blood thinners, and some systemic conditions such as leukemia and diabetes. Ignoring bleeding gums can have serious consequences. If left untreated, gingivitis can progress to periodontitis, a more severe form of gum disease that affects the tissues that support your teeth. When you have periodontitis, the bone and gums around your teeth start to pull away from the teeth, forming pockets that get infected. This infection can lead to tooth loss and other serious oral problems. The link between bleeding gums and periodontitis is significant, as the bacteria that cause gum disease can easily enter your bloodstream through the bleeding gums, spreading to other parts of your body. Low-grade inflammation is another concern when it comes to periodontitis. When your body is in a state of inflammation, it releases chemicals that can harm your tissues and organs. Low-grade inflammation is a mild form of this, but it can still contribute to several health problems, including heart disease, stroke, and diabetes. Periodontitis requires ongoing care to manage. If you have periodontitis, your dentist or periodontist may recommend scaling and root planing, a deep cleaning treatment that removes plaque and tartar from below the gum line. In severe cases, surgery may be necessary to repair the damaged tissues around the teeth. To be proactive about maintaining your oral and overall health, you need to know how to prevent and treat bleeding gums. Whether you've noticed bleeding while brushing or flossing, or you've been diagnosed with gum disease or another oral health condition, taking action to address the issue can help prevent it from progressing and causing more serious health concerns. Tips for preventing and treating gum disease. Importance of vitamin C for gum health. One of the most effective ways in preventing and treating bleeding gums is proper nutrition, particularly the intake of vitamin C. Vitamin C is a powerful antioxidant that supports the immune system and promotes collagen production, which is critical for healthy gum tissue. When we don't get enough vitamin C, we experience symptoms such as bleeding gums, which can be a sign of gum disease. Vitamin C deficiency also weakens our blood vessels and makes us more susceptible to infection. So, what is the recommended daily intake of vitamin C? The Food and Drug Administration, FDA, sets out guidelines for the amounts of different vitamins and minerals an individual should consume per day. It uses recommended daily value. For Europe, this is EFSA. But did you know that the daily dose for vitamin C was set 80 years ago? And that is not all. The recommended amount of vitamin C and other vitamins and minerals is based on not getting sick and not on getting healthier. When it comes to vitamin C supplements, choose natural sources over synthetic options. Synthetic vitamin C may not be as effective as natural vitamin C and can also come with unwanted side effects. That's why I recommend natural vitamin C sources like amla berry. I'll attach the link in the description. Some of the best foods to eat that are high in vitamin C include citrus fruits, berries, and leafy greens. Other important nutrients for gum health include calcium, phosphorus, and vitamin D. Green tea. Green tea is often touted as a healthy drink due to the presence of a powerful antioxidant called flavonoids. Flavonoids have anti-inflammatory properties that reduce gum inflammation. In addition to its anti-inflammatory properties, green tea has a number of other benefits for gum health. It helps neutralize harmful bacteria in the mouth, reduce bad breath, and even promote the growth of healthy bacteria. When it comes to enjoying green tea for its gum health benefits, it's necessary to make sure you're getting the right amount. Experts recommend drinking 1 to 3 cups of green tea per day. Polyphenols. Polyphenols are a group of plant-based compounds that are also rich in anti-inflammatory and antioxidant properties. These properties make polyphenols particularly useful for reducing inflammation in the body, including the gums. Foods rich in polyphenols include berries, grapes, pomegranates, dark chocolate, and even red wine. Green tea is also a particularly rich source of polyphenols, including a type called catechins, which have been shown to help reduce inflammation and promote gum health. Also watch the video, especially on polyphenols. Coenzyme Q10. When it comes to gum health, there's a lot of talk about vitamins and minerals, but have you ever heard of coenzyme Q10? It plays a crucial role in protecting and strengthening our gums. So what exactly does coenzyme Q10 do for our gums? Well, for starters, it helps to neutralize harmful free radicals that damage gum tissue and cause inflammation. It also supports healthy blood flow to the gums, which is necessary for delivering oxygen and nutrients to this sensitive area. Coenzyme Q10 is found naturally in many foods, including fatty fish, organic meats, and whole grains. And if you're not a fan of these foods, you can always consider a high-quality coenzyme Q10 supplement. When it comes to preventing bleeding gums and maintaining good oral health, what you don't eat is just as important as what you do eat. There are certain foods that actually harm your gums. Here are some foods to avoid if you want to keep your gums healthy. Sugary and acidic drinks. Soda, sports drinks, and fruit juices can all be highly acidic and full of sugar, which can erode your tooth enamel and contribute to gum disease. Sticky and chewy foods. Foods that stick to your teeth and gums, like candy, can be difficult to remove and can increase your risk of developing cavities and gum disease. Starchy and refined carbohydrates. White bread, crackers, and other processed snack foods are often high in refined carbohydrates. Their end product is sugar, which contributes to gum disease. Alcohol. Drinking alcohol dries out your mouth, leading to a decrease in saliva production and an increase in bacterial growth. In addition to a healthy diet, there are other ways to prevent and treat bleeding gums. One effective way is by using an electric toothbrush. Electric toothbrushes have been shown to be more effective in removing plaque and preventing gum disease compared to manual toothbrushes. They have built-in timers to ensure we brush for the recommended 2 minutes, and some even have pressure sensors to alert us when we're brushing too hard. Another way to prevent bleeding gums is by flossing regularly. Flossing helps remove plaque and bacteria from between teeth and along the gum line, where a toothbrush can't reach. Water flossers can also be a great tool for those who find traditional flossing difficult or uncomfortable. Proper oral hygiene. This includes brushing twice a day, flossing daily, and using an antiseptic mouthwash. Brushing and flossing help remove plaque and bacteria from the teeth and gums, which can help prevent gum disease and bleeding. Using an antiseptic mouthwash can also help kill bacteria in the mouth and reduce inflammation in the gums. Regular dental checkups and cleanings are also essential for maintaining good oral health. A dentist can identify and treat gum disease before it progresses and remove plaque and tartar buildup that can contribute to bleeding gums. Finally, quitting smoking is another important step in preventing and treating bleeding gums. Smoking has been linked to gum disease and can decrease blood flow to the gums, making it harder for them to heal. Overall, there are many steps that can be taken to prevent and treat bleeding gums. Comment down below on what steps you take to keep your gums healthy. Conclusion. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more tips on keeping your gums healthy. And if you have any other tips or questions, please leave them in the comments below. Take care of your gums, and we'll see you in the next video.